Hi, this is how you suction. First, you want to monitor the patient for indications of suctioning, so that could include a decreased SpO2, a sawtooth pattern on the flow volume loop, secretions in the ET tube, auscultation over the trachea. After you have assessed the need for suctioning, you're going to obtain your equipment, so sputum collection jar, vacuum tubing, you want a vacuum regulator, and then of course it's connected to your inline closed suction catheter. Once you have obtained the equipment, you want to do a chart review if you're not familiar with the patient. Once you've done a chart review, you can introduce yourself to the patient, inform them of the procedure, and then you're going to wash your hands, glove up. Once you've done that, you can put them in a semi-Fowler's position. Once they're in the semi-Fowler's position, you want to check to make sure that your equipment is actually working. So for experienced RTs, they can do that by applying their thumb to the end of the vacuum tube to feel for -100 to -150 millimeters of mercury. Sometimes the vacuum regulator is not calibrated correctly, so that could be a better way to check. Once you've checked your equipment, you are going to monitor the patient. Once you've monitored the patient for heart rate, respiratory rate, BP, SpO2, and there are no contraindications there, you will unlock the thumb port and hyperoxygenate your patient for greater than 30 seconds or until their SpO2 is 99% or greater. Once you have hyperoxygenated your patient, you could either lavage them with normal saline if they have tenacious secretions. If they don't, you can skip that step. You want to inform the patient that you're about to suction and tell them that they're going to be forcefully coughing. Once you've informed the patient, you can now stabilize the ET tube, and you want to advance the catheter down the airway. You want to make sure that this doesn't last more than 10 to 15 seconds, and you want to pull it up before applying the vacuum, and you want to intermittently apply vacuum as you twist the catheter out of the airway. Once you have withdrawn the catheter, you are going, while you're withdrawing the catheter, you want to continuously monitor the patient for heart rate, BP, SpO2 to make sure everything's okay while you're doing it. After you do that, you want to hyperoxygenate the patient for greater than or equal to 1 minute. After hyperoxygenating, you can auscultate bilaterally to assess the need for suctioning again. If they don't need that, then you can go ahead and lock the thumb port. After you lock the thumb port, you are done suctioning, and you can go chart and report to the RN. And that's it.